Good morning. Yesterday, the House Energy and Commerce Committee and the House Ways and Means Committee released the American Health Care Act.
The great health care debate round two has begun in Washington. This kicked off when House Republicans unveiled their plan to eliminate Obamacare, or the Affordable Care Act, and replace it with a Republican alternative. This has had the effect already of making everybody a little unhappy, which, by the way, is the story of health care reform in Washington. Republicans start by keeping some of the popular parts of Obamacare. For example, the provision that says children can stay on their parents' plan until they're 26 years old, or that people can't be denied coverage because of a pre-existing condition. But they also keep some parts of the plan that conservatives don't like. For example, the plan eliminates the individual mandate, the requirement that individuals buy insurance, and also eliminates the subsidies that the Obama administration and Democrats in Congress had put into effect to help poorer people pay for health care. But it also substitutes for those subsidies big tax credits, and some conservatives are saying those tax credits might turn out to be as expensive to the government as the subsidies turned out to be. And it doesn't roll back a big expansion of Medicaid, the federal government program for the poor that the Obama administration and Obamacare had kicked in. It extends that for a while, and in fact some conservatives think that the need to get more states enrolled, or perceived need by some states to get in before the program dies, may actually expand the Medicaid part of the Republican alternative. So conservatives are unhappy, liberals are unhappy because the subsidies are gone, and they're saying it's going to be harder for poor people to buy insurance now. As a result, everybody, as I said, is a little bit unhappy. I think the unhappiness that House Republican leaders and the White House have to worry about is unhappiness on the right, unhappiness among conservatives. This plan is not going to get Democratic votes. The administration and House Republican leaders don't expect it to. They do expect it to get nearly unanimous Republican support, so that's the action to watch in the weeks ahead.